Hello everyone, my name is Molly Barthel and I am a nursing student from Indiana State University. This video is for those with diabetes that are wanting some further education on how to take care of their feet. This is for my nursing class, Nurse 444, and this is Diabetic Foot-Care. All right. So this presentation is going to help those with diabetes become more informed on how to properly care for their feet in order to prevent any further complications. So this presentation is going to identify risk factors, components of healthy feet, as well as methods of action for diabetics to take to ensure they're taking the proper steps in managing their foot care. So our objectives. By the end of this video, you should be able to state the risk factors for developing diabetes, define the members of a diabetic healthcare team, identify the components of a healthy foot, identify common foot problems, state how to perform daily foot checks, and define methods to prevent further foot conditions. So right now I'm going to ask you to pause the video and you're going to take the pretest that's in the link in the comments, or it'll be in the description below. So then once you're done, hit play and we'll continue. All right, so risk factors for type 1 diabetes. So type 1 diabetes, typically you're born with it, or it's nothing that a person does, but it's just something that happens. So it's a lot of times because of family history, a person's age can affect that, and a person's race. So Caucasians are more likely to develop type 1 diabetes. And these three risk factors, so your family history, age, and your race, those are all what we would consider to be non-modifiable risk factors. So you cannot change those. Risk factors for type 2 diabetes would include if you are pre-diabetic, overweight, ages 45 and older, family history, sedentary lifestyle, history of gestational diabetes, or there's some other races listed there too that are more prone to type 2 diabetes. And so just like I talked about a non-modifiable risk factor, a modifiable risk factor would be being overweight or living a sedentary lifestyle. So you can choose to make changes in your lifestyle that are going to better you overall and help your diabetes. Okay, so members of the diabetic healthcare team. So it's so important to know that each person in your healthcare team plays a really important role in your success, in your treatment, and it's important to have them all involved. So the members of your healthcare team are going to include a primary healthcare provider, which this person is going to be in charge of your healthcare overall. They're going to oversee everything. Your podiatrist is going to take care of any issues you have with your feet. So if you develop a callus, if you need your nails trimmed, if you get a sore on the bottom of your foot, your podiatrist is going to be the one to address those needs. They're also going to see you at least yearly just to do a complete diabetic foot check and just see how your feet are doing. A diabetic educator is just going to keep you educated on what you need to know about diabetes, and your dietitian is going to work with you to develop a good diet to help maintain your diabetes or get you to where your goals are as far as your diet. All right, so it's really important in order to be able to find something not so good is when you can notice the normal components of a foot. So it's important for us to know what makes up a healthy foot, because did you know that a healthy foot bears 2 to 3 times a person's weight with each step they take? That is crazy. So if I weighed 100 pounds, which I do not, every step I took would be 200 to 300 pounds of weight on my feet. So that's why it's so important for your feet to be able to equally distribute that weight to help prevent any further issues with your feet, okay? So your blood vessels in your feet bring oxygen and nutrients. The nerves, that's what helps you to feel things, okay? So if your nerves are impaired, you're not going to feel as well. Your bones, they provide the structure to your foot and allow the pressure to be distributed equally. The joints, that's where the two bones meet, and that your joints also help allow for pressure and movement. And the skin is going to be your foot's first line of defense against any infection. All right, so some common foot problems. You have your corn and your calluses. So your corn and your calluses are going to be a buildup of like skin tissue. It gets kind of hard and it can be pretty painful to step on. Might need some trimming from your podiatrist, but definitely something you'd want to, let your podiatrist know if you're experiencing. Bunions, if you see there in this person's feet, the great toe, that first toe is causing it moves inward and it pushes that joint outward, which gives it's like a target for added pressure. Um, Hammer toes, they're kind of shaped like that. They're like a claw toe. And if you see on this person here, their second toe has some redness. That's because when you have hammer toes, there's pressure in places it shouldn't be. This is a diabetic foot ulcer. So this is something you for sure need to let your podiatrist or your healthcare provider know about right away. You want to get this taken care of as soon as you see any signs of these. And then you have an ingrown nail, which these can become infected too. And it's exactly what it says it is. It's a nail ingrowing into the skin around your toe. So how are you going to inspect your feet? We want you looking at the tops of your feet, the tops of your toes, the backs of your heel. Look at the bottoms of your feet, making sure there's nothing there that shouldn't be, any hot spots, any areas that are getting more pressure than others. We want you checking your nails and in between your toes, making sure there's no fungus, anything like that. We want to make sure you're looking in your shoes too, because if your feet aren't feeling things normally, you might have something in your shoe and you didn't even know it. And it's important to look at your feet every day so that you catch anything early on so it doesn't become something bigger. And that's just so important. All right. So when should I call my doctor? There are some key things that you want to make sure you know to look for so you know when to contact your provider. So any increased redness, streaking going up your legs, or abnormal color changes. If you have a sore or a blister, any increasing amounts of pain in your feet, worsening of a burning sensation, swelling that seems to be getting worse, or any drainage in your socks. Those would all be reasons to contact your provider. So preventing feet problems. We want to make sure you're getting regular foot checks with your healthcare team. Practice self-care. Ask questions. Take really good care of your feet. So problems, like I said, can come up really quickly, and we want to make sure you're getting them addressed soon. Ask questions. Advocate for yourself. Make sure you know what to look for so you know what to talk to your doctor about. So, and here are some additional resources for you to look at if you have any other questions. And then here are the answers to your test. I hope you all learned something from this presentation and can use this in the future. Thanks for watching.